Oh, I'm so glad you're all here. That's awesome. Um,
Mhm. Coaching
so the way I do reviews is I know I don't know who needs to mute, but there's a whole bunch of background noise. Um, I like to just use the blueprint review guide. That's what I'm asking you to study, so that's what I use. Okay. I like to go over some test taking strategies and answer any questions. So as we go through this review guide, what we have to be thinking of is knowledge to judgment. Okay, so you need to be thinking about what kinds of questions are going to be asked on the exam that are clinically based, right? So about clients, about taking care of clients in the community. Okay. We're not testing your knowledge for definitions. Okay. I mean, we're not testing, yeah, we're just not. We're testing it for your clinical judgment. As you've seen with the last two quizzes, right? The last two quizzes are all about clinical judgment, taking your knowledge and putting it into practice. That's the way you have to think of the exams. Okay. There's questions, don't be afraid to select all and select all that apply. There are typically some questions on each exam that all will apply. All right. So when I do student reviews, they said, oh, well, I didn't think we could check all of them. Yes, you can. If all seem correct, answer all of them. We talked about this in one of my quiz reviews, which is if you get to a question and there's more, it's not a select all that apply, and there's more than one answer that looks like it could be correct, what do you do? Go back and read the question. Did you miss something? Did you miss, like, what's the greatest? What's the first? What's the priority? So if you get to a question, there's more than one answer that look correct and it's not a select all apply, please go back and read the question. The other thing I cannot stress enough is these are for you overthinkers. Okay. If the information is not in the question, it doesn't exist. Nobody's asking you to figure out what happened 6 months ago or, well, what if that happens? What if, what if, what if, what if? If the information is not in the question, it doesn't exist. So don't put information in the question from your overthinking. Does that make, who does that? Anybody add information from your brain into questions? Yeah, Crystal. Yeah. Do not overthink. Okay. All the information you need to answer the question, to pick the right answer, is right in the question. Okay. Do not change your answers unless you accidentally clicked on the wrong answer and you know you need to change it. Unless you can convince yourself concretely that you picked the wrong answer, please do not change it. You know, the scenario of, oh, I think I heard her mention that in class. Oh, I think I read that somewhere. Oh, I think whatever. Those are not concrete example or concrete reasons to change your answer. It may have been one of you guys, I don't know, but I had a student, I think it was was it this past week or last week, that took a quiz and she changed a bunch of answers and all her original answers were correct. So be careful about changing answers. Okay. Um, I always like to tell students that, after you read the question, don't look at the answers yet. Okay. Come up with the answer in your mind. All right. You read the question, you think, okay, the answer should be this. And then go look at them and see if that is there. That's most likely the correct answer. I know students use that strategy as well. Come up with it and come up with the answer in your own mind and see if it's there. I've heard from students, lots of students over the past 3 years that they like to use the highlighter. Okay, they like to use the highlighter to the first time they read the question, they like to highlight any important words or cues or phrases. So if you haven't used, I'm just throwing out things that I've heard for the last several years from students. What strategies do you guys have and use that could be helpful to your classmates? Anybody else have any other strategies?
I read the questions, the answers first, and then I read the question.
Okay. Okay. Who else has a strategy?
I usually cross out the ones I know for sure that it makes sense.
Mm-hmm. And that's with the underline, right? That's with the other.
Yeah.
Yeah. Yep.
Yes.
That's also a good one as well. Crossing out what you know doesn't make any sense.
Mm-hmm.
The other thing is do not spend a ton of time on one question. The rule of thumb is to have a read at the question twice. Okay, if you still have, pardon me, if you still have no clue, just make an educated guess and move on. Okay, it's one question. Pardon me?
Oh, no, sorry, that's my family talking.
Oh, that's okay. So don't stay on one question for 5, 7, 8 minutes. Okay, you're gonna know after reading it twice if you don't know the answer. Okay. That's what I can think of off the top of my head. Have you heard these before in your other classes as you strategize how to take exams?
Yes. Yes.
Okay. Okay, great. All right, let's go to the guide. Can everybody see my screen? Yes, no? Okay, thanks.
Yes.
So everybody should have a copy of this. This is the Blueprint Concept Guide. This follows your syllabus for the first 3 weeks. Okay, I've copied and pasted your readings for all 3 weeks, so you have a quick reference to go back to. You don't have to go looking at your syllabus. It's all right here. Okay, so all 3 weeks. So same exams as other classes, multiple choice, 50 questions. There'll be select all that apply. There'll be some basic math problems, 75 minutes. The other thing to remember is negatively asked questions. Does everybody know what I mean by negatively asked questions? What that means, let's say you're teaching a family, you're teaching a family that may be at risk for obesity. You're teaching them the long-term effects of obesity. Okay? If the question says, what might a parent say that would indicate they need more instruction? They need more teaching. That's a negatively framed question. So what are you looking for? You're looking for an answer that the parent says that's incorrect, right? Like if a parent says, well, they drink fruit juices, 100% fruit juices all day, all night. Is that wrong? I'm gonna stop sharing for a minute because I want to see your faces. Does everybody understand what I mean about a negatively asked question?
Yes.
It's important because there are negatively
All of them are All of them are right except for one. What was said wrong from
Correct,
the client.
but yes, but I want you to understand the concept around. You're looking for something that somebody says that's incorrect. If they need more teaching or if they need more instruction, if they need more practice, whatever, that's a negatively asked question. Does that make sense? Because there are negatively asked questions on this exam. So I want you to be able to recognize them. Does everybody understand that?
Yes.
ma'am.
Okay.
Yeah, I get
Okay.
it better now.
Okay, good. Because once I get to reviews after the exam and I'm reviewing with the student what they got wrong and they're negatively asked questions, the student goes, oh, I didn't even think about a question that was asked like that. Okay. All right. Okay, so we know this is not an all-inclusive study blueprint concept guide. Okay, what we do know, I can tell you, is I put this together based on a few things. Based on your 3 weeks of blueprint concept notes, lectures, and readings. Okay, so this is an excellent, my point is, this is an excellent summary. I highly suggest you're not going back and doing all the readings again. My suggestion is if there's anything on this guide that you don't understand or you may want to reread, then absolutely go back to the readings. Okay? But for right now, this is a really good summary. Okay, so what I would be pulling out to study, if you have a good understanding of this study guide, and you can take these concepts and apply them to practice, you're going to do great on the exam. Absolutely great. Okay? If you have a good understanding of this guide, you're going to do great on the exam. What I would study is this guide. I would start there. Okay, start with this. If you have any issues with, say, introduction to vulnerability, you don't understand something, go back to your week 1 notes on introduction to vulnerability and read that whole section. This is a summary. Does that make sense? If you have any questions on the school nurse, let's say you read this section on the school nurse and you think, not quite sure I understand this. Go back to week 2 and read your concept notes. Okay? Everything's connected. Your syllabus is connected to your notes, your weekly notes. Your weekly notes are connected to this guide. All right? So that's my suggestion, is start with this guide and see how you do. Can you, let's see, introduction to community nursing. Well, we've got 2 definitions here, community-oriented, community-based. So if there's a question about community-oriented and community-based, what do you think it's going to be? You think it's going to be giving you a scenario?
Yes.
Jerry-Lynn, give me an example.
Just like, for example, when you talked about the nurse working in a facility teaching an adult or high school child about I don't know, the
Use their inhaler.
physical care or how to
Yeah.
use an inhaler, how to
Yeah,
you
it
know
was right.
take care of their diabetes or whatever.
Yep.
That's just an individual
Right.
Mhm.
Yeah,
Community.
absolutely. So let's say you're given a scenario and I've given you examples here. Community oriented nursing, we know that that's the big picture, right? We want to get oriented to the community, meaning we're looking at the whole population. Versus community based, we're working in the community. That's where all those roles come: the school nurse, the home health nurse, the hospice nurse, the occupational health nurse, right?
Mhm.
Right. So I give you examples here. So an example of community oriented, providing education to families about the importance of vaccines.
Like the home health nurse going into a small home, teaching a group of people,
Mhm.
several families within a home.
Yeah. I
Okay.
mean, if you're providing education to families about the importance of vaccines, that's a general task. You're not saying we're going into we're going in to talk to the families of the kids that we know that have not been vaccinated. This is an education program for all families about the importance of the vaccines.
Okay. Like the
So
two.
that's oriented. That's for the better of the population,
Okay.
right? Where community based, here's an example: providing data on mortality rates to people who may be vaccine hesitant. So this is a specific group we're working with, right? Vaccine hesitant people. Make sense?
Right.
All right. This could be a this could be a hospice nurse, community based, working with the family of a dying patient, community based. School nurse working in the clinic, teaching kids how to use inhalers. It's pretty simple. Community oriented is big picture. You're primarily focused on the whole population rather than illness care. Okay, so you're focused on a whole group rather than individuals.
Okay.
And then community based, you're working in the community. You're based in the community.
Okay.
Does everybody understand that?
Yeah.
There's a couple of
Yes.
questions. There's a couple of questions about um, scenarios. You're just going to have to identify whether it's community oriented or community based.
Okay.
Okay. Levels of prevention. We've gone through this in class. You're starting to hear this more, right?
Right.
You have to understand that primary P is prevention, secondary S is screening, tertiary T is treatment. Okay. Primary, you're trying to prevent something. This is an excellent summary box, by the way. You're trying to prevent something before it ever occurs. Secondary, you're screening, early intervention, early identification, early treatment, right? You're trying to reverse the course, right? So let's say you have a group of kids who are obese, they're at risk for obesity. Well, you want to target them to say, hey, listen, let's talk about a healthy diet, healthy exercise. Let's try and reverse this because here's the risks of obesity
So that would
down the
be
road.
education, right? We
Yeah,
would be educating.
yeah,
So
let
would
me,
that be primary? Sorry.
no, good. Thank you for bringing that up. So I'm going
Yeah,
to
I'm
talk
trying
about
to figure it out.
education in a minute. I'm going to talk about education in a minute because people look at education as primary, but it's in all three levels. And my students
Yes.
have already heard this, but I'm going to go through it. Tertiary, treatment, management, trying to reduce the symptoms, trying to improve the quality of life. Remember with tertiary, they already have to have something. So if you get a question about pick whatever answer is tertiary, make sure the answer has a client with a diagnosis, right? They
Okay.
have to have something. All right, let me give my spiel on education, or do any of my students want to give my spiel on education with regards to the three levels?
We'd like to hear from you.
Okay, all right. So students confused education being just in the primary. And that's why I don't use education when I say primary is prevention, secondary is screening, tertiary is treatment. Education is at all three levels.
Okay.
all three levels. Think about it. Okay, don't get thrown off with education being primary. We're educating in the primary to prevent, right? We're educating to prevent. Secondary, we've identified risk. Now we're educating to try and reverse. Stop the development of whatever, the disease, the condition, whatever.
Could you repeat that one more time? You said secondary is
Screening.
the identified risk, right?
Yeah, second, it's right here. Early identification, early intervention. Okay, so let's say we've identified, I'll use the example I just used, a group of students that may be at risk for obesity.
Mhm.
We then educate them on longer term risks of obesity, right? So we are educating them. Okay. And then let's say let's stay with obesity. Let's say you've been diagnosed with obesity. We're at the tertiary level. Okay, well, education happens there too, because what are we trying to do? We're trying to teach them how to manage the disease, teach them how to reduce the symptoms, improve the quality of life. So my point is education happens at all three levels. Don't get caught up with education just being a primary intervention. Does that
So
make sense?
it
Go ahead.
it kind of makes sense to me, but not all the way. So I get the primary, secondary, and how education is on all of them. But that question, the scenario you use first to the teenagers about being at risk, like would they ask us like, is it primary, secondary, or tertiary? Which I know tertiary means they have it, and then the secondary is the screen for it because since they're at risk. So that would I pick? I don't even know if they'll have that as an example, but would it be secondary then education for
What's the
for the teenagers that will be at risk for
yes,
obesity?
yes,
Okay, because I was trying to
because
figure out that.
well,
That's
look,
where
let's think about this. If you have identified a group of teenagers who are at risk for obesity, you've
Mhm.
already done that screening,
Okay.
right?
Yep.
And now you're going to try and help educate them so that it doesn't get to the tertiary level.
Got it. I was just trying to get that a
Yeah,
little bit.
no.
I
Does that make
understand it
sense?
more. Yeah, it do to me now.
Okay, good, 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 good. Here's what you need to know about Healthy People 2030. Okay, this is it right here. Okay, we're going to talk about one of the goals of Healthy People 2030 is to reduce firearm related deaths.
Mm.
Okay, so here's some information about how we reduce firearm deaths or what their strategies are. Okay, so please be familiar with this paragraph. There is a question about gun safety.
Mm-hmm.
Okay. Social determinants, big focus, big focus with Healthy People 2030. Right? We know that social determinants of health have a huge impact on people's health. Right? Where you live, where you were born, where you live, what's your housing look like, education, food security, right? Those are social determinants of health. Safe housing, transportation in neighborhoods, any kind of racism, discrimination, or violence that goes on in neighborhoods, education, job opportunities, income, access to nutritious foods. Do you have polluted air, polluted water? And then language and literacy skills. Those are the 6 social determinants of health I want you to be familiar with. Do we understand about social determinants of health? These kinds of factors. So do we have safe housing? Is there discrimination? Is there a high crime rate? Are there good schools? Are there job opportunities, or is the unemployment rate high? Income, do people live in poverty? Access to nutritional foods. Do they have grocery stores, physical activities? Are there parks? Are there walking paths? Okay. Do they live near a transportation hub? airport, trains, industrial, that might cause them to have polluted air, or they live near rivers or streams, waters. All these things determine people's health and well-being and quality of life. Okay, so that's social determinants. Okay, introduction to vulnerability. Okay, we already talked about all the different kinds of vulnerable populations that we have in our communities. They're numerous. For purposes of this class, we consider the poor, the homeless, pregnant teens, not adult teens. Okay? Like we had in our quiz, one of the questions was, who's vulnerable? And somebody said there was a 26-year-old pregnant person. Okay, that's not considered vulnerable. They may end up having a vulnerable pregnancy, but for purposes of this class, teen pregnancy. Okay, so don't get thrown off with any age group other than teens. Okay, veterans are vulnerable, migrant workers, immigrants, talked about that, severely mentally ill, substance abuse, chronic STDs, HIV, hepatitis B, C, complex physical disabilities. So, I mean, you look around your own community, you know who the vulnerable populations are. Okay? Poverty, important. This is important. Okay, for you to know this. All right, poverty. This is a blanket factual statement. Poverty is the primary cause of vulnerability. Okay, we know that poverty levels are increasing all over the US. Okay, the homelessness is exploding in numbers. Okay, education plays a role. Okay, poverty is the main cause, but other factors, education. Higher levels of education create better choices. Okay, we talked about resiliency and education. Okay, higher education increases self-confidence and resiliency. We talked about that this past week in class. How do we encourage resiliency within our clients? Disabilities, another factor with vulnerability or vulnerable populations. You guys can read through this. Outcomes. What are the outcomes of vulnerability? We should start to have an understanding of that. What are some outcomes of vulnerability? Increased morbidity, mortality. What else?
Communicable diseases.
Increase in communicable diseases. Maybe higher poverty rate.
Mm-hmm.
Right?
Right.
What else? Maybe increase in chronic diseases.
Right.
Increase in violence.
Increase in violence.
Mhm.
And think about it. Think about the vulnerable populations and how at risk they are for poor outcomes. Right? And then we go through a list of lots of interventions. The most important with the vulnerable population, and we reviewed this in class, is therapeutic communication. What that means is it is primary for us to develop compassionate, kind, caring, trust is the most important thing, relationships with these vulnerable populations. Most of them don't want to be where they want to be, where they are, right? You've got to no judgment, no assumptions, let them tell their story. Okay. So therapeutic communication, recognizing the role of resiliency. And don't forget caring for the caregivers. Think about it. We can't forget about the caregivers, whether it's in a facility or in the home. Okay, think about, let's do the home since we're talking community health. Think about the caregivers in the homes caring for chronically ill family members, right? Or hospice. Okay, they are at risk, right? They're at risk for mental illness, whether it's burnout, stress. We don't want them to be at risk for neglect or abuse, right? We want to make sure we have a handle on them as well. You know, education on, maybe we educate them on, you know, how to reduce stress. Because we recognize that it is a very difficult role. Okay, so let's think a primary prevention for this group would be educating them on caregiver stress and burnout, right? Teaching stress reduction techniques, encouraging them to go to a support group with other caregivers, right? Secondary screening, secondary intervention with this group. Maybe we're screening for anxiety, depression, neglect, right? To see if they're at risk for that. Does that make sense?
Yes, ma'am.
Mhm.
Okay, next is in working with the homeless. Again, creating a trusting environment. Trust is essential for the development of a therapeutic relationship. Okay. They're very mistrustful of healthcare workers. So you can read through the section on homelessness. We know that homelessness is correlated with poor health outcomes. That paragraph describes that. Okay, the school nurse. This is my specialty. I just retired from school nursing. And I can tell you that when I started, school nurses were typically in the clinic for emotional support, Band-Aids, ice packs. I can tell you that we triage everything now. Okay, we're doing catheters, catheterizations, trach care, diabetes care, insulin injections. Okay, but what you have to remember, think about yourself as a school nurse in a busy school. The kids are in and out of the clinic all day long. You've got to think about your ABCs and safety. Okay, we know that kids come in for a variety of reasons. Okay, but the one thing I want to mention is common complaints include headaches, stomach aches, whatever, variety of things. You have to be able to think about if you've got a student coming in same time every day with the same complaint and it's been 2 weeks and you know she doesn't have a stomach ache or he doesn't have a stomach ache, they're coming in at the same time, whatever. We as school nurses have to further our assessment. So what could we potentially be thinking about?
If he's being bullied.
Bullying, harassment.
Mhm.
Some students will come to the office complaining of headache or stomach ache to escape something, right? To escape bullying or harassing or whatever. We need to be able to take it a step further and maybe find out what class they were in, right? What's going on prior to the student coming to the clinic? Are they in a certain classroom that ends with harassment? Are they going to a classroom that they know they're going to be harassed in? So it's important to know what's going on prior to the onset of whatever their headache or stomach ache they're complaining about. Okay. We're still in school nurse deals with obesity a lot. Okay, so this paragraph talks about obesity. Okay, we know that the rates of obesity are increasing, steadily increasing, and have been for a while. All right, so in teaching parents about obesity, what kinds of things might you teach them about? Healthy food choices, follow food pyramids, avoid snacks, Include avoid sugary snacks. There's the 100% fruit juice. So if you ask a parent, let's say if you ask a parent, so what are you doing in the home with regards to your 3 obese children? What have you changed? And they say, let's see. They say, well, we let them drink 100% fruit juice all the time. That's wrong. So we need to correct them. Okay? Make sense?
Mm-hmm.
Limit,
That might be
screen time,
go ahead.
limit like screen time in the house, like have them go
Yep.
outside for, free
Yep.
day. Just like have
Well,
a play day outside,
yeah,
get
exactly.
some vitamin D.
Yep, that was one of the quiz questions about, a kid we want them to get out and exercise, healthy diet, healthy exercise.
Yeah, I
We
second
all,
guess myself on that question.
were you, Krista? Unemployment and depression. We see the effects of that in schools. Okay. Unemployment, depression, family issues, right? We may see may see academic decline, adjustment problems, social functioning, right? Emotional insecurity, right? So research has shown that children whose parents have been diagnosed with depression are more likely than children whose parents have never been diagnosed to experience interpersonal and social conflicts and potentially school failure. That's just a fact. School nurses' initial interactions with the family should support the goal of establishing a productive and culturally sensitive rapport. There's lots that go on with the school nurse. Okay. We're working with lots of different cultures, lots of different requests, lots of different values, beliefs, practices. We have to be culturally sensitive and culturally competent. Okay. And again, I'm just going through this. You need to read the full text of it, but I'm just summarizing. What about one of the things that a school nurse also deals with is the kids who are starting to date. All right. There's a very high risk for violence for adolescent students that start to date. Okay. So, what would you do? What would you, if you were interviewing an adolescent student who just has begun dating? Here's some examples of what you would ask the student. Describe the relationship, right?
Open to any, establish like an, trust with them and have an open,
Mhm.
relationship with them, to build
Right.
trust and,
Right.
when you see and notice,
Mhm.
different things, just kind of talk to them, once you build that and
Mhm.
just, keep an open communication line
Right.
with them.
Well, levels of
Your
violence,
education.
domestic violence,
Yeah.
believe it or not, is a big risk
Mm-hmm.
with these adolescents that are starting to date. Okay. So
Mhm.
you're right. Ask open-ended questions, give them the opportunity to share. Questions like, does your mother approve of the relationship? Or none of that matters. We just want to establish how this adolescent feels about the relationship with
Right.
her new partner,
Right.
right?
Mm-hmm. Yes, ma'am.
Poverty increases the likelihood of abuse risk as well. Poverty in kids increases the likelihood of potential abuse risk.
Mhm.
Food insecurity, susceptibility to infections, developmental delays, academic issues. See this all the time in the schools,
Mhm.
especially in your schools that have a community that has high poverty rates. You see this with the kids.
Yes, ma'am.
Yeah, growth and development. Couple of things to remember here. Educating new parents about safety guidelines for infants,
Mm-hmm.
regular checkups, when should they happen? Okay, it's all right here.
Okay.
Caring for an immunocompromised child, right? What do we teach the family to help prevent infections in the home? Here's the teaching points right here.
Mm-hmm. Okay.
Common childhood ailments. I'm not going to go through this section, but what I'm going to tell you is there's a couple of questions on the exam about each of these. Okay. I have taken your notes from week 2 because it's pretty long about the common childhood ailments, and I have summarized each of them into about 6 or 7 bullet points for each one. So my suggestion is that you use this document for reviewing your common childhood ailments. If you go back to your notes, that's fine, but it's a much more extended version of each one. I've summarized the important points that you need to know about each one. Make sense?
Yes, ma'am.
Okay. So you guys go through this. As you can see, they're much more summarized, much more focused. Use this document to review your common childhood ailments. And remember, there's questions about every one of them. Some of them have a couple of questions, some of them just have one. Okay. Family health. And again, all these yellow highlighted topics are right from the blueprints, are right from your notes. So everything should look the same. Okay. Again, here, family nursing, health risks. We talk about obesity. So again, kind of repeat, but that's what came up with family risks. Okay, last week, we covered this week. This is what we're so my Monday students have already gone through this. My Wednesday and Friday we'll go through it today and Friday, but migrant workers, okay? There's 3 special vulnerable populations we're covering this week. Migrant farm workers, rural population, and then the homelessness/poverty. Okay, the home, I'll go to the end real quick. A lot of this we talked about in the introduction to vulnerability. Or at least in the introduction to vulnerability in week 1, we start to talk about the homelessness and people living in poverty. This expands that. Okay, this week we expand on that. Okay. With regards to migrant farm workers, I simply want you to read through these 2 sections and then wait for class because I don't want to go through. It's much more. You'll have a better understanding of these 2 sections after we go to class. Okay, so for the students that have already attended Monday class, this is all going to look familiar to them. All right, so my suggestion is wait for class, then go back and review these 2 sections, or actually 3 sections. Okay. And then if you're having trouble understanding, reach out to me. We can do a quick tutoring session. But basically, why do we think, just in general, why do we think migrant farm workers and the rural population are considered special vulnerable populations? Think they have additional risks?
Yes, of course.
I can tell you for migrant farm workers, their biggest for purposes of this class, is pesticide exposure.
Yes.
Okay. Rural population or migrant, we'll do all this in class. Rural population, huge risks. People in the rural population don't have the resources we have in the cities. Right? They got to travel. They don't do their wellness visits. So therefore, when we see them, they're sicker. Okay. So, what are you guys thinking? You going to be okay?
Yes, ma'am. I think you explained it a lot better.
Okay. All right. What are the rest of you thinking? Helpful
Yep.
to go
Yeah,
through?
it was helpful.
Yes.
It's just
Okay.
a matter of
Very.
just want more details.
Exactly.
Being
And again,
consistent with reading.
go ahead.
I said being more consistent with reading.
Yeah,
Yes, that's the biggest thing.
there's a method to my madness.
Got
Yes,
to
ma'am.
read.
It's just right now it's just time management. Just this Zooms help because it kind of forces you like because I get anxiety. I got an exam in med surge 2 at 1 o'clock. But I've been doing this, so I was like, nope, I gotta take a break and then just
Yeah.
not cramming, just understanding it and going
Yeah.
over the material.
Yeah. Remember your mind shift. You're not in a hospital anymore. You're in the community. It looks different. And when you're working in a hospital, nobody's talking about all the vulnerable people in your community.
Right.
When you're working in the community, that's what you notice. So you guys will be fine. You'll be fine. You have a good understanding of the study guide and can apply that into the clinical setting. You're going to be fine. You'll be fine. All right.
Thank you
So
for that.
I'm going to, Crystal, did we say we were staying on after? Are we gonna, okay. All right. You stay on. I'm going to stop the recording.